In our morning rounds, being heart smart with your smartphone. More than 43,000 apps focus on health and medicine. Heart monitoring is among the top categories, but can you really rely on them? Dr. Zubin Eapen is a cardiologist and assistant professor at Duke University. We are partial to all things.
Smart.
Yeah, so you already have an advantage, Dr. Eapen. It's very good to see. We're very Duke friendly here. So do you think, is this something you recommend for your patients, using an app? You think they're reliable?
Gail, this is a very exciting time in medicine because traditionally doctors have needed to be in hospitals or clinics to treat or monitor or manage patients. But now some of these new technologies, these apps and sensors are allowing us to monitor and manage conditions at home. Some of them are not ready for prime time for clinical use, but can provide patients with helpful information in terms of what they might see at home.
Okay, let's talk about blood pressure and measuring your heart rate. Very important in terms of heart health. How does it work?
So it's a great question. Blood pressure is a very important part of preventing heart attacks and strokes. There are apps out there that allow you to document or log your blood pressure. Most of them don't actually measure your blood pressure right now, but provide you with a diary so that you can show your doctor or your caregiver what your blood pressure trend over time has been.
But some of them do it by touching the camera lens, is that right?
That's right. So there's one app called Instant Heart Rate by Izumio. This has now been folded into a fitness tracker that they have, which uses the camera lens on the back of your phone. You place your index finger over the camera lens and allows you to detect your heart rate, similar to what you use in an oxygen probe that you might see in a hospital.
That's really cool.
I like that.
Yeah.
And you're okay with the results? You think that they're reliable?
That's a great question, Gail, and I think this is something we're not completely sure of yet in terms of how reliable these apps are. The FDA is trying to regulate some of these apps, particularly those that might influence patient care, to make sure that it doesn't cause undue risk or harm. So some of these apps need to be controlled, and they need to be studied better and integrated into the clinical workflow so doctors know how to use it.
So I'm confused. What are you saying? Are you saying we should do it or we should not do it? Because if they're not reliable, why would we even think about doing it?
I think this is something that's still good for fitness and activity and for those who want to measure things about themselves. For people with active cardiac conditions, I think it's still very important to make sure that you see your doctor.
What is that device right there?
This is a great example of where we might be going. This is one that's used mostly in Europe and Israel and is coming to the United States. There are EKGs that you can get on your phone. This is an example of one called the LiveCore, which you can get an EKG simply by putting your fingers on these leads on the back of your phone. That's one single lead of an EKG. And once you get in a hospital, actually take 12 different pictures of your heart. This could do this at home. The important part is if you have chest discomfort, chest pain, symptoms that might be concerning of a heart attack, you should really go see your doctor and seek care first.
All right. Dr. Zubin Eapen, great to see you. Thank you so much.